Hi, my name is Emily Greer, and I did my voiceover PowerPoint on the medication administration record. So the medication administration record, what is it? It is a barcode technology that provides a system of checks and balances to ensure medication safety. It automatically tracks medications from the order from the doctor to administration. So orders from the doctor are placed into the computer automatically, and the orders must be verified by pharmacy before the medication can be administered. Pharmacy is going to run checks with the patient's allergies and other medications that they're currently taking to ensure that they can be taken together and that there will be no interactions that will occur. Through this technology, it provides a check that ensures the 5 rights of medication administration are met before the nurse administers that medication. The medication administration record also helps to drastically reduce the amount of time that nurses spend on documentation, and it improves patient safety. So how the medication administration record works. The person who is administering the medications must log into the computer and the system so it's known who gave the medication. And then the patient's barcode on their identification bracelet is scanned, which prompts the system to then pull up their medication orders. When the patient's barcode on their identification bracelet is scanned, it also performs safety checks as well. And it also checks the 5 rights of medication administration and makes sure that they are met before any medications can be given. If there is a discrepancy between the order and the medication that was scanned or a contraindication for administration, the system will then generate an alert which will pop up. So for example, if you have the wrong patient's medication administration record pulled up and you scan a medication that is not ordered for them, a pop-up alert will occur and it's telling you not to administer the medication because it's not safe to give to this patient as it's not their medication. This technology also correlates with lab values and vital signs, which will bring up associated data that should be checked before administering the medication. So for example, if you're administering a blood pressure medication that has the parameters of holding if the heart rate is less than 60 or if the systolic blood pressure is less than 100, it is going to pull up the most recent set of vital signs for that patient so that the nurse can check to see if it's safe to administer that medication to the patient. So if the most recent set of vital signs say that the patient's heart rate was 55, the nurse will then hold that medication because of the parameters that were listed underneath the medication, and the nurse then knows it is unsafe to give that medication. Another example of how this technology correlates with lab values would be if a patient is to receive a potassium pill, their most up-to-date lab result will pop up, so their potassium level will pop up, and if it is higher and out of range, the nurse will see that and he or she will know that they should not administer that medication because it's unsafe and it's only going to continue to raise their potassium level. It is important to note that mistakes can still be made within this technology, and even though it is performing safety checks and it is checking the 5 rights of medication administration to ensure everything is correct and safe to be given, it's still the responsibility of the nurse to perform the rights of medication administration to ensure that a medication error does not occur. It is a really nice aspect of the medication administration record that it does pull up the most recent set of vital signs and lab results, but it's also important for the nurse to check that they are within a certain amount of time. At Mount Nittany, where I work, if you're, for example, giving that blood pressure medication with parameters, the most recent blood pressure and heart rate need to be within the last hour of when you're giving the medication. If it's not, the nurse needs to retake the vital signs and have a more up-to-date set of vital signs so she knows for sure that it is safe to be given, or if she needs to hold the medication. So the 5 rights of medication administration are the right patient, the right drug, the right dose, the right route, and the right time. So all of the rights must be entered into the medication order as well. So the doctor has to specify all of those things. They need to specify the dose they want given. They need to specify the route, the frequency, and the time that they want it to be administered. They also need to specify if the medication is supposed to come in pills, capsules, liquid, injection, etc. That all needs to be listed so that pharmacy can verify it and the nurse knows exactly how to give the medication. And like I mentioned before, it's still the nurse's responsibility to double check the 5 rights of medication administration, because even though the electronic medication administration record acts as a double check, mistakes can still happen within the system, and the nurse that is giving the medication must make sure to double check those as well. So some benefits of the medication administration record. There is a reduction in medication errors. It does promote patient safety. It improves workflow efficiency because nurses are able to spend more time at the bedside with their patient instead of documenting, because the medication administration record decreases documentation time. So we are able to then spend more time one-on-one with our patients, focus on what their needs are, and give them the time and attention that they need instead of being so concerned with spending time on our documentation, making sure it's done, making sure it's correct. We are able to focus more on our patients, which is our number one goal. Another benefit is there is a more accurate documentation. So nurses on different shifts can look back at previous medications that were given and what times they were given and what dose. For example, on my unit, I work on an orthopedic unit and we have a lot of surgeries. So a lot of people are on pain medications, and we can look back to see when the pain medication was last given, who gave it, what dose they gave, and then we can figure out when we are able to give that medication again, because it is so important to make sure you're not giving pain medications earlier than they were supposed to be due again, because we don't want to overdose our patients. And that's a really nice feature, being able to look back and see the exact time it was given, what their pain rating was at that time, and when we are able to give it again safely to our patients. And then it also provides us with easier reporting to our superiors, our patients, our coworkers, pharmacists, etc. So for example, like I mentioned with the pain medications, our patients ask, what time did I last have my pain medication? When can I have it again? We can look right back and give them the exact time down to the minute that they were given that medication, so they know when they can have it again. Or if the pharmacist calls and needs to ask you a question about a medication and they need an order clarified, we're able to look back and give them the exact details of when the medication was administered, how much was given, and then they are also able to view that as well on their end. So some barriers or cons of the medication administration record are, unfortunately, as good as computers can be, there is still computer downtime, or unfortunately the system can crash. And Not many people know what to do when that happens. You have to resort back to paper charting, which a lot of new nurses have never had to experience before in their career. And it can kind of be scary because you have to make sure you write everything down, make sure everything is noted, especially with medications, what med you gave, the exact dose, and the time, whereas that's all automatically charted in the electronic medication administration record. If the system were to crash, you have to resort to other methods, but still make sure you are doing everything safely for your patients. Sometimes patients feel as if the nurses focus on the computer more than interacting with them, because they feel like the nurses are facing the computer too much or clicking around on the computer too much and not facing the patient and interacting with them directly, which I have seen happen often. And a lot of people as patients don't like that. They want to be talked to face. They want to feel like the nurse is focused on them and not the computer. And basically everything we do as nurses is on the computer, so it's hard to find that balance, but you want to make sure you're still, facing your patient, talking to them, giving them that respect so that they don't feel like your whole focus as a nurse is on the computer. Like I have previously mentioned, glitches and mistakes can still occur within this technology system. So as nice as it is, we just need to continue to be careful and make sure we are reading everything correctly, double checking everything, getting cosigns on medications that need to be cosigned to try to prevent as many mistakes as we can. Also, some healthcare providers still might not feel comfortable with the electronic medication record and the overall system. Older providers still might not completely understand how the system works, and they might try to find workarounds for the system, and it also can become very frustrating for them, which could lead to mistakes or errors occurring. I do work with an older nurse who cannot stand the computer system. They were always used to paper charting, and it does get very frustrating for them trying to figure this out. And when you do get frustrated, mistakes can occur because you're so focused on being angry at the system and not focusing on what you're actually doing. And then the electronic medication administration system, they are expensive in order for the facilities to purchase the system and then have their staff members properly trained. So it costs the hospitals or other facilities a lot of money to buy these systems and the equipment and to have it all installed and get it up and running. And then also extra expenses can come from needing to bring in people to properly train the staff on the system and the equipment so that they can use it and complete their jobs effectively and safely. When it comes to patient safety, reducing adverse drug events is vital to all healthcare organizations, and medication management solutions can significantly reduce errors and increase patient peace of mind. Implementing the electronic medication record helps hospital ensure the 5 rights of medication safety, that the right patient receives the right drug at the right dose, at the right time, with the right method of administration. So by scanning barcodes on patients' wristbands and medications at all points of care, efficiently meets mandates for increased patient safety and supports higher staff productivity. The electronic medication record provides information on the patient's allergies, drug interactions, duplicate therapies, potential dosages errors, monographs on the individual medications. So if a medication that the patient is actually allergic to accidentally ends up on their medication administration record, and the nurse would happen to scan it and not notice herself that that was one of their allergies, a pop-up will be generated telling them to not administer the medication because it's unsafe for the patient because they are allergic to that medication. That's another benefit of this system because it is providing another safety check, as if that did not happen and the nurse accidentally gave that med, a serious interaction could occur. Another thing that's very helpful on the electronic medication administration record is that it provides monographs on each individual medication. So when the nurse goes to give that medication, if he or she is unaware of what that medication is for or how to give it, she can click on the monograph, and they are very helpful because it gives you the information that you need to know about that medication. So for example, some medications come in a powder form. So if you were to click on the monograph, it's going to tell you what it can be mixed in and how much. So for example, with Miralax, it tells you to mix the powder in 4 to 6 ounces of water or juice and mix it well until it's completely dissolved, and then the patient is able to drink it. It's really nice because it just gives you the extra information that you would need on a med, especially if you're unsure of what it is or what it is for. Nurse satisfaction when it comes to the electronic medication administration record, it's associated with overall nurse satisfaction and perceptions of improvement in workload, teamwork, ease of documentation, drug information accuracy, and patient safety. Nurses no longer have to try to struggle to read an ineligible handwriting of the doctor's orders, which could potentially lead to a medication error. I know previously with paper scripts, it is very hard to read doctor's handwriting sometimes, and the wrong med or the wrong dose could have been administered for a patient, which could lead to a serious interaction and med error. So it's a lot nicer that the orders are automatically put into the computer, so no one, whether it be the nurse or the pharmacist, has to try to read handwriting that they can't read and a medication error occur. It also helps lessen the stress of medication administration with all of the additional resources that come with the EMR, like the monographs and the lab vitals popping up, or the lab results and the vital signs popping up. It provides you with a bunch of additional resources, which makes things easier for the nurse. Some recommendations to improve the EMR: ensure the technology is working properly by testing all devices and making sure enough computers, scanners, and devices are available for use. Measure the compliance using patient scanning compliance reports. Where I work at Mount Nittany, we get a monthly paper put into our mailboxes telling us the percentage of our scanning. So it tells us the percentage of us scanning the patient's wristband and also our percentage of scanning the actual medications. It tells us where we have room for improvement or if we are doing well, which is really nice to know as a nurse, because wherever you need to improve, you definitely want to try to improve on that. And then also to ensure that all nurses and other healthcare providers who are going to be using the technology is properly trained on that system. If they're not properly trained, mistakes can happen and they aren't going to be able to do their job in the most effective way. So we need to really ensure that they meet all their competencies and everyone is properly trained. My summary: the electronic medication administration record is a barcode technology that provides a system of checks and balances to ensure medication safety. It provides nurses with a safe method to ensure that medications are administered correctly and safely. It has drastically improved patient safety, decreased medication errors, and decreased the amount of time nurses spend on documenting. And there are many benefits when it comes to the electronic medication administration record, but the number one benefit is it promotes patient safety, which is our overall goal as nurses. This is a slide of my references. And then a final slide of my references.